Charlton Murove joins me in studio. Charlton, it's great to have you with us. Firstly, one of the big things that your report has found is that there's been an increase in the number of older healthcare professionals that are leaving the public sector for the private sector.
Yes, that's right. Thank you for having me. From 2000 to 2017, there's been a 52% increase in the number of healthcare professionals. And that was accompanied by an increase in average age. So that suggests that these people are not coming fresh from university or training colleges. They are probably coming from state facilities.
And is there any indication of why they would be making that move?
It's not clear. We do not collect such information, but maybe people can just speculate on the reasons why.
But in terms of the move, then also, what you're also saying is a disproportionate allocation of healthcare providers, especially geographically.
Yes.
Talk to us more about that.
Yeah, so it's disproportionate in that if you look at the same period, first of all, the number of beneficiaries on medical schemes increased by 27% only. So you have more healthcare professionals coming in, but the number of people they are saving is not increasing. And then the second disproportionate portion is what you're talking about, where you have some provinces having a lot of providers per population aspect compared to other provinces, like the Western Cape and Gauteng. They have much higher proportions of providers, including specialists, compared to other provinces like maybe Limpopo or Northern Cape.
And of course, part of what this then does is that it increases that burden that we're seeing in the public health sector, and I suppose as to the inability of the public health sector to retain those skills.
Yes, most certainly, because I think if I were a provider and I had to work when I do not have a team supporting me, it increases the workload. So the situation does not really help the public sector.
But of course, this situation also points to concerns that would be there, especially in the public's minds, as we head closer and closer to 2030, where we should be having full implementation of the NHI. What then do figures like this do for that kind of process?
Yeah, I think it depends with how you see the news. What it tells me is in the private sector, we have a lot of free time from the providers who could actually be helping out. So I think it's an opportunity for the state to contract with the provider so that they can offer services, never mind the location, but at least they can release the burden on the state.
A free time that comes with more money, of course, because the people they're servicing are people on medical aids, right?
Yes, or even the government can pay for some patients through capitation arrangements, so that patients who go to public can even go and see these providers during their free time.
Let's also talk about the exit rates that you're talking about in this report. Is it exit rates from the profession overall, or what were you looking at specifically there?
For these providers to claim from schemes, they have to renew their practice numbers. So when they don't renew their practice numbers, it means they are no longer claiming from schemes. And we do not know the reason why they stop to claim from schemes. Obviously, they are no longer practicing. We don't know the reasons why they leave or where they go to, but you can only speculate. Maybe some emigrate, or some go and start working in companies. You might even suggest that some might even go back and work in the public facilities. But it's quite worrying, because if you see some of, especially the primary care providers, you would find that if someone joins at the age of 20, you would expect them to be in the system until they are 60. But the average rate we saw from the figures is they would leave at about age 45 or 50. So it's a bit of time lost in terms of investment the country has made in training these professionals.
All right. Well,
yes.
Certainly interesting and useful information for all of us to keep in mind, and certainly especially as we edge closer and closer to a government's plans to implement the NHI. Thank you for coming into studio tonight. Charlton Murove from the Board of Healthcare Funders of Southern Africa.